Welcome back. Today we are going to discuss wound care solutions that could really benefit from the technology of hyperbaric oxygen therapy. This treatment involves breathing pure oxygen in a pressurized chamber. Dr. Priya Asija is a wound care specialist and a hyperbaric oxygen therapy physician at SAAK Health. It's great to see you, doctor. Thank you for being here.
Thank you for having me.
So I've been to your offices. They're absolutely beautiful. And I remember how excited you were about this hyperbaric oxygen therapy chamber. How often is it that a physician has something like this on location?
Very rare. I think we are only two people in Milwaukee and surrounding areas are having a private practice with a hyperbaric oxygen therapy.
Wow. Yeah, that's a big deal. So your specialty is wound care, as we've talked about a few other times here on the show. And like I said, I've been there and met you there where you work. How important is it to you to bring this therapy specifically to your patients?
It helps a lot. Accessibility is our mantra, as we always talk about. And with that said, this is very important aspect for chronic wound healing and other indications.
Why is it important for, especially because I know you're very, your skills are help people who have chronic wounds. Why is this sort of a game changer? Why does this help so much for people who've had wounds chronically?
Because increased oxygen to the tissue will increase blood supply to the tissue. It will help grow new blood vessels, which we call it neovascularization. And that will also decrease infection.
So are people healing faster? Are they recovering quicker? And can you get the wounds healed maybe for people who've been experiencing things that just seem like they're never going to go away?
Yeah, we are seeing patients who have had wounds for a couple of years, not weeks.
Years?
Years.
Wow.
And they have tried every treatment modalities that can help them. But hyperbaric oxygen is definitely a game changer. And you see, these people are people who are more than 50 to 60 years of age, who has had chronic medical conditions like diabetes, hypertension, poor vascularization of the legs. And that will, this oxygen, hyperbaric oxygen under pressure, will create new skin or will increase the chances of getting reepithelialization, which is skin growth.
So sometimes we've talked about grafts or skin substitutes. Is that, so if you do something like that medically, is this sort of like works in conjunction with that to help people, again, heal faster?
Yes, it does.
I bet people who've had chronic wounds, because I feel like there's stigma surrounding chronic wounds, and I bet a lot of people who come to you are at a place in their life where they're feeling pretty down about it.
Yes, because these wounds are not good to look at. They do smell. It's an embarrassment for them to go in public. So doing wound therapy and talking to these people, this is uplifting for them.
I'm sure. I'm sure it is. When I think about a chamber like this, I've read of alternative uses. For example, depression is just one that I've read about. But are there any other types of conditions, especially chronic conditions, that a hyperbaric oxygen therapy helps with?
It's now being used for Lyme's. Lyme's,
Wow.
as you know, Lyme's is very endemic in Wisconsin.
Yeah, Lyme's disease, and a lot of people have it for a very long time, maybe aren't even diagnosed, but suffer with it for a long time.
Chronic Lyme's people have chronic fatigue, they have depression, they have muscle pains and stuff like that, and this will help them.
How long does it take if somebody uses the therapy? How long how many sessions before you know if it's helping?
At least they have to try it for 10 sessions.
Okay. Okay. So sometimes it takes a little while and you have to do multiple sessions, but they're seeing progress.
For Lyme's, it has to be a 12-week therapy.
Okay.
And it is Monday to Friday, 5 days a week. And we put them in on 2.5 atmospheric pressure to increase oxygenation to the tissue. increased blood supply to the tissue. It also helps in treating wound infection because, as you know, some bacteria will have, they like lack of oxygen and then they grow. So this oxygen will help them.
It's wonderful. You're doing such great work there. It's a beautiful facility, easy parking. It's so accessible. Thank you so much for being here. Really appreciate it. And you're one of several specialists there at SAAK Health. And right now, SAAK Health is offering a great deal for a $200 cash fee. So here's how it works. When you spend that money, you're going to get a consultation with Dr. Asija and a 1-hour session in the hyperbaric oxygen chamber. Now, if you've been curious about hyperbaric oxygen therapy, you can visit SAAK Health to see if it's right for you. Their beautiful new campus is located on Capitol Drive in Brookfield. Here's the number to call. It's 262-444-5148. You can also visit them online at saakhealth.com for more information.